Emmanuel Jones, not his real name, works as a psychosocial clinician in Liberia's main coronavirus treatment center, the 14 Military Hospital, along the Monrovia-Rowersville Highway. He was among the first batch of healthcare workers recruited to fight the virus in March, with a monthly salary of $600. But he claims it was cut to $300 the following months, starting from April. Jones has worked in Liberia's health sector for more than 11 years, but claims he's going through one of his worst experiences. He asks for anonymity for fears of losing his job for speaking out. We have altered his voice to conceal his identity.
I was paid for March and April. I haven't been paid for May, June, July.
I haven't gotten May pay and part of June.
Jason Coffey worked at the 14 Military Hospital as a mental health clinician. In June, he was fired. He claims it was for inciting other hospital staff against the administration over poor working conditions and delayed salaries. He now works at a local clinic in Monrovia City, outside Monrovia. But he still demands his unpaid salary from the 14 Military Hospital management.
There are outstanding payments, but they are going to have that settled.
Dr. Jerry Bryan is the case lead of the Incident Management System, the body that manages Liberia's COVID-19 response. Bryan blames an audit of compromised payroll listings for the salary delays. But delayed pay isn't the only issue confronting healthcare workers at the hospital.
Like for some of us that already know about the PPE business, we spend 3 to 4 hours before coming. And it is not easy. It is not an easy one. You are seeing patients, you are performing a role as a nurse, and at the same time you are doing a counseling.
The risk is very high to the extent that the PPE you use doesn't fit you. Even the face shield is not available. The gloves are not available.
Yeah, the workers have been cared for in terms of their basic protective care. Supplies have been a little challenging compared to that of Ebola.
Bryan played a key role during Liberia's Ebola crisis and was named Time Magazine's Person of the Year in 2014, along with other Ebola fighters. He praises the overall working conditions during COVID-19 compared to Ebola. We obtained exclusive access to the 14 Military Hospital to confirm the workers' claims. Not all healthcare workers have gloves, face coverings, and personal protective equipment called PPEs, but those treating critically ill patients in intensive care units do. The bathrooms are tidy and sanitary. Buses are available to commute workers to and from their homes. But many other health facilities across Liberia do not have access to buses, electricity, or even running water. Sarah Moore, not her real name, worked as a nurse during the Ebola outbreak and now at a local clinic in Monrovia. She also asked us to conceal her identity for fear of reprisal.
We don't have running water here. We the nurses are here, we borrow water to run our activities here. That is affecting us, especially when it comes to this pandemic. The nose mask, we use a nose mask and then we wash it, we use it.
Healthcare workers are succumbing to the virus. So far, 6 healthcare workers have died of COVID-19, while more than 200 have tested positive for it, according to the National Health Workers Union of Liberia.
The reason our members, the healthcare workers, are coming down with the high rate of infection currently is because of lack of training and a lack of PPE provision in the facility throughout the country.
Health Minister Wolomina Njala denied our repeated requests for a sit-down interview. But our media team issued this written statement denying the union's claims of lack of training. Since Ebola, we have conducted multiple RPC training over the years. On the issue of PPEs, the ministry concedes in the statement that they are in short supply. We have provided those equipment and still making frantic effort to provide more. Jefferson Nat, Program Director of the United Methodist Human Rights Monitors, insists healthcare workers deserve better treatment for their numerous sacrifices.
These are people who are on the front line. These are people who are risking their life, who are giving out everything. These people deserve every support they need. They deserve good incentives. They deserve hazard pay. They deserve good salary. They deserve equipment to protect themselves.
During Ebola, healthcare workers were given household benefits for the risks they took to save lives. But nothing is available for those fighting COVID-19 despite a donation by the World Bank.
We come in contact with so many diseases. When we live on the job, something happened to us. What will become of our children?
We are not getting our regular pay. Then you're talking about hazard.
On the issue of household pay, this is what the ministry had to say. We as a ministry are discussing with the World Bank to ensure the possibility of making some household payments to our health workers. There are more than 11,000 public sector healthcare workers in Liberia, but they struggle to fight COVID-19. That number was reduced recently when health authorities retired more than 400 healthcare workers. 499 more will follow in October. The ministry says the workers are being retired because they meet one of the criteria set out in the pensions law of Liberia. It will be replaced with volunteers currently in the system. If the transition is not seamless, the retirements could further impact Liberia's ability to contain coronavirus, which is already crippled by limited training, delayed pay, and reduced staff. Health workers continue to demand better working conditions from the Weah administration.
This is our grief and pain that we went through.
So we're just appealing to our president that he help us to protect all healthcare workers. We are appealing to them that they pay us our hazard pay.
And that's why the president needs to pay attention to this. He needs to pay attention. He needs to investigate the Ministry of Finance, where all the money, the millions of dollars that have been pumped into the system, the sector.
This report was produced by PowerTV in collaboration with New Narratives as part of his West Africa Justice Reporting Project. I'm Anthony Stevens reporting.